Hi, I'm Matt Collins. I'd like to welcome you to Bob Weber Auto Mart on Douglas Avenue here in Racine, across from Douglas Park. We specialize in 1-year-old, low mileage, almost new cars. And if you'd like to stop by and see them, or see them on our website, bobweberautomart.com, we could save you between $5,000 and $10,000 on your next almost new car purchase.
I'm Michael Burke, and this is Money Talks. Hi, welcome to Money Talks, the Journal Times online business show. I'm business reporter Michael Burke, and with me today is Bernie Powers of, well, you say your law firm's name.
It's Foley, Shannon, Powers, and Rusch.
Yeah, Bernie does, you do estate planning and elder law, and we're going to be talking about changes at the federal, well, more at the state level, I guess, but in long-term care programs for certain seniors. I think this is going to be a show that could be applicable and really interesting to a lot of seniors. May not know certain advantages that they can tap into. Full disclosure, I hired you to write my will for me. So, Bernie, the what is the program we're going to be talking about here?
It's government programs to help people pay for their long-term care. Nothing to do with doctor or hospital bills. Those are paid by, if you're 65 or older, by Medicare. But after you're not in a situation where they're trying to cure or improve you, instead you're on a plateau, then it's called long-term care. And Medicare pays up to 100 days, and after that you're self-paid. You're expected to pay out of your own pocket.
And we're talking about paying for nursing homes, assisted living, what? Paying for what exactly?
Yes, if you need the skilled care that a nursing home provides, or it could also be living at home and you just need people to come in and assist you with your everyday needs, eating, getting up in and out of bed,
bathing.
Dressing, bathing, all those basic necessities of life.
Yeah. The amount we're talking about, if a person is in a nursing home, that's sort of the worst case scenario, and that's what it used to be, and we're going to talk about the departure. But in a nursing home, what does this federal program pay? And it's called Title 19 is the...
Yes, it's Title 19. It's part of the Social Security Administration. It's actually under the Medicaid component of Social Security Administration. And right now, if you are on this program, the government will pay up to approximately $6,000 for your nursing home expense
per month, right?
Per month. If you usually you have some income coming in, and so the government pays for the excess that you don't have.
Now, let's define the population we're going to be talking about, just in general terms. Who's eligible for the kind of care we'll be discussing? What's that population?
Well, for the most part, it's the elderly. If you are 65 and older, if you're disabled and under 65, you could also be eligible.
And there are certain asset qualifications that we'll come back to. But tell us what has changed. This, again, is federal money, but it's administered by the state, and something has been changing, including in Racine County. And what is that?
Yes. Previously, you, in order to get the benefit of this government program to help pay for your care, you had to move into a nursing home. If you were still living at home, you were not eligible. So the government decided they didn't want to encourage people to have to move into a nursing home just to get the benefits. So they now have expanded the program considerably. You can be now living in your own home, your own apartment or assisted living, and still get the benefits from the government.
Which is a huge change, of course.
It's a radical change, yes.
Yeah. When did this change, and was this a statewide change?
This program is like a federal government, state government partnership. So the federal government lays down certain mandates and then gives the states a certain amount of discretion on how to administer it and have slightly different rules. So they started in Milwaukee County with this program, sort of like a test pilot, but they've now been expanding it to other counties. So last year, they'd actually,
That would be 2012.
2012, the state had put a cap on the number of people who could rely on this, it's called family care, and they had reached that cap and actually had a waiting list. Okay, and then you may recall in the news, late last summer, early fall, the state was required to remove the cap and service everybody who qualified for this program. So now there's been a lot more seniors that have been getting the benefit while still living in their own place.
Who would, let's stay with the family care program, which is going to be a little different than the next one we'll talk about, which is Iris. But under family care, who would you be hiring for these kinds of services? Are you restricted to who you can hire? Or?
In a sense, there are private businesses that send care providers to your home, and these are private businesses.
Huge industry, by the way.
Yes,
Yeah.
This is not government business, government-controlled business. This is private business, and they hire people to come in and provide the service, and you simply have to be certified with the state in order to be hired and draw and receive payment from the government program. If someone is strictly self-paid, not drawing benefit from the government, then they can hire anybody they want. But if you are getting family care or the IRIS benefit, it has to be an approved agency that's providing the caregivers.
And again, you might hire them for cooking, what about administering medications or help with that sort of thing?
Well, for the more skilled care, usually you need a licensed nurse to come in if it's not going to be a family member. And so...
And could this money be used for that in
Yes.
that case? Okay.
Yeah, the money can be available for really your whole range of needs. They come in, they send a skilled person to evaluate your needs, and that's what determines what services are eligible and what the government will pay for after you've used your own income to contribute.
Now, you mentioned if a person was in a nursing home, this government program would supply about $6,000 a month, which of course that's a lot of money, but nursing homes generally cost even more than that per month.
If you're self-pay, yes.
Yeah, right.
If you're not on this program, you pay whatever you and the nursing home agree, and different nursing homes have different rates.
Right. But now, what if you're living at home? Presumably, the cost of what you need is going to be a lot less because you're not in a 24-hour facility. How much a month can one get for the kinds of services we're talking about at home?
The majority of eligible persons are receiving under $2,000, $1,000 to $2,000 typically. But the average is actually about $4,000, and that's because there's a number of people that get higher amounts, including over $10,000 a month.
Really? At home?
Yes. So that brings up the average
over
what the majority are receiving in the $1,000 to $2,000 range.
That's interesting that you can get more at home than you could get than the amount for the nursing home would be. So that's the family care program. IRIS is somewhat different.
They have...
IRIS, by the way, is an acronym for something. I know it has the word respect in it, but...
IRIS. Include, respect, self-direct. So the idea is that trying to encourage people to manage their own care, obviously often with the help of family members. They want to keep the family members involved. So family care is where the social worker will help select which agency will be coming in with the input from the family. But IRIS is radically different in one respect. They basically give the money, the budget, to the eligible recipient himself or herself, and then they hire basically whoever they want, and they can even hire a family member. They could hire their husband or wife to take care of them, their daughter, son, cousin, sibling.
They can hire people who are already helping them and just start paying them with government money for what they're doing.
Yes.
Keep the money in the family.
Mm-hmm.
Now, that sounds like it would be hugely more desirable than family care. So what would determine which of those two programs you would end up in?
Basically, if you have, whether or not you have family members able to provide the service.
Okay.
Okay, so it could be a combination. You have some family members who provide some, and then you decide which agency to hire to supplement what your family members cannot handle.
So, just make up a case. There's a 77-year-old man, and his wife is still able enough to cook and basically keep house, but he's not. He can start paying her for the things she's already doing, right?
Yes.
Yeah, interesting. Now, we touched briefly on the fact that there are certain asset rules to qualify or not qualify for these programs. So you want to talk about that?
Well, this is a means-tested program. Everyone is not eligible. You basically have to be out of money. Mm-hmm. But that's a general concept, and then there's very, very specific rules. So if you're single, you can have up to $2,000 of liquid assets. So if you have more than that in the bank, you must first use it up, and then when you're out of money or down to the $2,000, then you can apply. There are a few exempt assets. You can.
Excuse me, you couldn't even apply until you're down to that 2,000?
You cannot apply until you're down to 2,000.
Okay.
Right. So if you apply and you got 3,000, they'll reject it.
Okay.
So then you have to come back and refile. So, but you can also have a car, essentially of any value. They don't put a limit on how much. I don't encourage anyone to go out and buy a Mercedes-Benz or something like that. But the idea is that that way you have a family member drive you to doctor appointments. Mm-hmm. You can have household furnishings. You can have a burial fund. But it is pretty limited. You can have term insurance. Now,
can you own your home?
If you're living at home, you can keep your home. They don't make you sell your home, at least during your lifetime. They might take the house after you are passed, but while you are either living at home or you feel you will want to move back home, the government does not require you to sell your home. Mm-hmm. Mm-hmm. Now, if you're married, your health, let's call him or her, your healthy spouse can have a minimum of 50,000 of liquid assets, and then it's a formula, so they can potentially have up to 110,000 of liquid assets. If you are unable to live at home, but your spouse is, they don't make your spouse sell your home. You get to keep your home. And then there's various other exemptions available to your spouse. And then there's another category, we call it unavailable assets. Okay, and a very common one is a lot of parents are gifting part ownership of their homes to their children. Mm-hmm. We've done a lot of these deeds year in and year out. So what you do is you gift what's called a remainder interest to your child or children, and you reserve a life estate. So at this point, you're part owners with your children. You have sole occupancy of your house for the rest of your life, but at your death, your life estate goes away, and then your children become 100% owners of your house. So this is an unavailable asset, and this is how...
Where does that term come from? Unavailable to whom or to what?
It's in the law. Yeah, I mean, that's the term that is in the rules.
Okay.
So they could have called it something else, but they
Okay.
call it available versus unavailable. And so it's a common planning technique is to gift this part ownership of your house. It's not for everybody. If you're intending to sell your house and move into an apartment or condo or something, may not be a good idea to put your children as part owners. But so that's the other important category besides the exempt assets.
So of course your job in these cases is advising people on, what they can protect and what would make sense for them to protect. But does the government, this is obviously a very expensive program. There's a lot of talk about deficit reduction and debt reduction nationally. Does the government do anything to try to recoup all that money it poured into keeping you alive for those last years of your life?
Right. They have what's called the estate recovery law. Let's take the house, for example. If you're single and you're living in your home, then you go and you move elsewhere and you can't move back home, they will put a lien on your house. And after you're gone, or if your doctor concludes you're no longer be able to move back home, at some point though, they'll get reimbursed out of the sales proceeds of your house.
Does the house become the property of the federal government or who?
Well, it's either the recipient or his or her heirs. Government simply has a lien on it. So when it is sold, then just like if you have a mortgage to a bank at the sale, the bank gets paid off what their loan balance is. Same thing here. The state will be entitled to reimbursement up to the amount of the benefits received during lifetime.
So it reimburses the state or the federal government?
Well, it's a partnership, so it goes back to the state, and there's like a pool that the federal government gives to the state, and the state then spends it. So it goes back into that, let's call it a pot of money.
I see, yeah. You mentioned to me that you don't necessarily see this situation remaining fixed. Why is that?
Right now, our state is working on the 2-year budget. Okay, that kicks in July 1st, runs through June 30th, 2 years out. And over the years, this program has been increasing in cost. So every few years, they do make radical changes because people are doing planning and taking advantage of the various rules to try to protect some of their assets. And so we now are facing another set of radical changes. They're right now in the pending legislation that's going to be passed whenever our legislature agrees on it and it's signed by the governor. So they are closing a lot of the current planning opportunities and making it a lot more difficult to qualify for the program.
Planning opportunities, and some would call that loopholes, I suppose, but they're...
Loopholes, I mean, it's the law. And in addition, they're expanding the estate recovery law, so they're going to be able to go after some of the assets that otherwise may escape recovery under current law.
And the intent of the coming change is just that it's such an expensive program. It's just a way to try to contain that a little bit, right?
Exactly.
Yeah. Well, Bernie Powers, believe it or not, we're just about out of time here, but thanks a lot. It's a complicated topic, so thanks for helping me understand it a little bit. You've been watching Money Talks. I'm business reporter Michael Burke. Bernie Powers, say the name of your firm again, please.
Foley, Shannon, Powers, and Rusch.
And thanks to our producer, Greg Shaver. Please remember, Money Talks.